Okay, Happy New Year. Welcome back to another episode of Healing at the Speed of Light. My name is Dr. Jason Roundtree. I'm a chiropractor and a certified medical laser safety officer. I'm also the founder of Laser Therapy Institute, which is a healthcare provider membership organization of laser therapy professionals. If you are looking for effective, well-done, professional laser therapy, please go to our website. You can find a clinic near you. It is lasertherapyinstitute.org. I'm joined today by Christy. Christy is a certified laser tech, and she's also in charge of putting together all of our online coursework for doctors. So everybody gets to take her courses and go forth with that. And it's the absolute best training in the world when it comes to provider-focused training for using Class 4 laser therapy devices. So, we're back.
We're back. New year.
New year?
Yes.
New you?
Oh, not necessarily new me.
That's probably good.
Yeah.
Yeah.
But always improving, though.
Yes. Do you have New Year's resolutions?
I don't have resolutions. I have goals.
Yeah, that's good.
Yeah. Always, the next thing. What's next?
Mm-hmm.
So, how about you?
My only thing is, like you said, goals. I want to try and get to the gym more than 2 days a week. Got to find a way to do that.
Yeah. My gym was closed yesterday, so I had to do what I was supposed to do yesterday today. That's all right.
Yeah.
Got
to deal with holidays.
Still get it done.
Still getting it done.
So we'll help you out. Keep you consistent.
Appreciate it. It's hard. It's hard. For me, at least. I know a lot of people don't seem to have any problem with it, but the discipline of getting there when I could be doing other things is kind of tough.
It is hard.
Yeah.
It is hard. But
okay, well, you came here not to hear about my New Year's plans, but more to talk about what the title of this episode is, which today is Burning Mouth Syndrome, Burning Mouth Pain, which is, as we're going to learn here in just a few minutes, a type of neuropathy pain.
That's what I read in the preview, and it's like, this sounds really interesting.
Right?
So,
yeah.
Sometimes you think I already know everything, but I don't. I learn it all from Dr. Roundtree. So
I purposely don't let Christy really prepare for these because I figured the questions that she might have, patients might have as well. And so that helps give us a little bit better narrative, I think. So it's good.
It's
Plus,
fun.
I get to catch her unawares with things.
It's exciting. always an adventure.
You're very flexible. I appreciate that.
Oh, it's fun.
So let me give you the title of the study we're looking at today, because here on the Healing at the Speed of Light podcast is what we do. We bring up studies that have been done on light and laser therapy. We talk about how they were done, why they matter, and how you as a patient could potentially benefit. And that's exactly what we're doing today. So this study is titled Outpatient Oral Neuropathic Pain Management with Photobiomodulation Therapy, a prospective analgesic pharmacotherapy paralleled feasibility trial.
Titles are always fascinating.
It's quite long, but it's actually quite descriptive. This was published back in March of 2022, which we can now say is last year.
Last year, but still very recent.
Still very recent, yes.
Still very recent.
Principal researcher was Reem Hanna, who I'm very excited to say is produced a great paper here. Her and her team have produced a great study.
Nice.
This was published in MDPI's Antioxidants journal. And it's very, very detailed. It gives us all the information that some studies don't always give us. So I'm not going to get into all the details, but if you want to get a hold of this study and read the details, there's so much information here. Very, very thorough. I was very impressed. And it's neat because we get to see this laser therapy paralleled with medications. That's essentially what the title is saying. For burning mouth pain, laser therapy versus medications, two groups running in parallel. Who does better? It's like a head-to-head fight.
Ooh, interesting.
Yes.
Exciting. And the paper will be available, in the podcast session notes.
Yes.
So.
Yes. Yep, exactly. So we'll be dropping a link to this particular study. Right now, for some reason our stream is a little bit weak as far as our internet strength. So if it's not coming through well for you, you might have to catch the recording. But this will be published not only on Facebook and our YouTube channel, but also on all major podcast platforms. So if you're missing parts and pieces right now, I apologize. I tried fixing the connection, but It's only so good.
New year, new bugs.
That's true.
So.
But definitely catch it. Apple Podcasts, Google Podcasts, Pandora, Spotify. Yep, lots of places.
Just search for Healing at the Speed of Light.
There you go.
So
let's talk first from this study. Let's bring out some quotes from the study on what burning mouth pain is and how it happens, and then how it's kind of treated. We'll start there so that if you're not familiar with this, perhaps it'll give you a kind of a foundation or help you realize it may be something that you or another person is dealing with is actually this condition. So they say that burning mouth syndrome is a distinctive neuropathic entity commonly affecting the anterior 2/3 of the tongue, so the front part of the tongue, and usually only half of the tongue.
Interesting.
They say that it can be described as an intraoral, inside the mouth, burning or dysesthetic sensation recurring daily for more than 2 hours per day over more than 3 months without obvious lesions on examination. So that means even though you've got this burning and weird tingling thing going on the tongue, there's no obvious sores. You can look at it, it looks normal. There's nothing detectable on the surface of the tongue despite the level of pain.
Okay.
They say that it is neuropathogenic in nature, indicating dysfunction at the peripheral and central reflex arc paths and the processing of cortical excitation. That simply means that it's not only a problem with the nerve in the mouth, but it's also a problem with the way that the brain interprets those signals too. So it's a central and peripheral nerve problem.
Does it have anything to affect the taste or the sense?
Yes.
Okay.
That's a great question. It actually does. It affects a lot of things. There's the pain, yes, but then also it does affect your sense of taste and of course texture for like eating. But there's a whole list of factors that they evaluated here that affect the quality of life, and that is everything from, of course, speech and eating and drinking to things like kissing and sleeping, smell, even pronunciation, makeup application, shaving, brushing the teeth. I mean, there's a whole bunch of things that are really affected by burning mouth syndrome that you don't really think of until you're unfortunately experiencing it. But yeah, all those things are affected by this painful syndrome. And again, this is something that goes on for more than 3 months. So it's a chronic problem you can't really get away from, which means that, you try and find ways to deal with it, but maybe the taste thing is
3 months. I mean, 2 days would be too much.
Yes. Yeah, that's what most people who have this thing. 2 days is too much. Anytime, really. It can be quite intense, or it can be a little bit lower level. Different cases are handled differently based on the severity, but it's an actual irritation of the trigeminal nerve, one of the branches of the trigeminal nerve.
Okay.
Have you heard of trigeminal neuralgia?
I have.
Yeah. So a lot of times trigeminal neuralgia will presents across the face, and you can feel it here. This is just a different branch of that affects these areas. But trigeminal neuralgia pain can be severe, just excruciating, with no real good solution.
Right.
I've got one other quote I wanted to read here. I've got to just make sure I find it first. Nope, we got it. Talking about some of the... I kind of jumped ahead, but yeah, because, even things like social events and family relationships can be affected. You think about confidence with speaking, confidence going, having dinner with people, and you've got this going on.
Well, you use your tongue for so much.
Right.
And if if the inside of your mouth is being affected, I can imagine all those things being affected.
Yeah. Yeah, for sure. Yeah. So how do you think this is typically treated, if you had to guess?
Mouthwash.
Hey, yeah. There are some anesthetic type mouthwashes. They're temporary in effect, but they can give you some kind of numbing. Unfortunately, that doesn't really help your sense of taste.
Right.
Yep.
Right.
Good. Yeah.
I don't know, medications, obviously.
Yep, medications. That's really about it. They say that there are pharmacological and non-pharmacological strategies in managing this pain, but they're challenging. They say it's noteworthy that some systematic medications are effective in the short term, but can be associated with major side effects. So they say going from there, trying to avoid side effects and get people some relief. They say that photobiomodulation therapy, or as we often say, laser therapy, could be a promising alternative treatment modality. And the way that laser works is essentially that light is absorbed in parts of the cell that produce energy and also are responsible for the metabolism in the cell, and it helps to normalize those cells, which returns them to a healthy functioning state. Mm-hmm. That's the 2-second view of it. There's a ton more information in this study. Like I said, if you want to know the details, there is a huge description of all the mechanisms. It's a really fantastic layout. So I encourage you to read the whole study if you have the interest in that. But that's as deep as I'll go into the details there. So yes, so medications are typical. There are some mouthwashes, but laser therapy has been looked at for actually quite a while now as a way to treat this, to try and avoid some of the side effects, and also treat it from more of a holistic repair perspective, because that's what the laser does. It really returns these cells to more normal function. Mm-hmm. If you're going to do medications, they typically suggest utilizing amitriptyline, duloxetine, gabapentin, or pregabalin as an initial line of treatment, and switching it up to 3 times if the initial, second, or the third drug isn't well tolerated or it's not effective. And then in some cases you have to actually go up on the dosage depending on the patient. They say the initial benefits of some of those medications can be noticed within the first or second week of the treatment course. However, it may take up to 2 months for full effects to be present. And that's different than what we typically think of with medications. You typically think of, I'll take this and I'll feel better right away.
Right.
It's not actually the case.
Not the case.
No, not with this one. Not with a lot of neuropathies, actually.
Right.
When we talk about diabetic neuropathy in the feet, just taking gabapentin as it's prescribed doesn't always give you great relief right away. Sometimes it takes time. Sometimes people just don't get relief.
Well, and as you know, and as we've talked about before, there are just so many different side effects with medications that, as you'll probably talk about, don't happen with laser.
Right. Yeah, so. Exactly right. That's exactly right. We don't have any worry on side effects when it comes to utilizing laser, which is to say quite a bit when you consider the possibility of side effects with a lot of these medications. So, to really break this down further, in this study they had a total of 28 participants, and half of them, a little less than half of them, went on medications, the medication route, and the rest of them went to just laser. So some people had just medicine, and then some people had just laser therapy. Okay. For those on medications, they had the standard kind of medication dose. They did say that the doses of the medications needed to be increased for all the patients in that group at the 3-month mark. And two of those patients actually needed another medication added.
That was going to be one question I had is, they just added, like you just said a couple minutes ago, some medications aren't tolerated well by some, so you have to try something different.
Right. So
did they have to change the medication that way for the medicated patients?
Yes. Within the first couple of weeks, actually, they were not able to really collect good data on how those patients were feeling in the first couple of weeks, because so many of them had to start and then change a medication because it wasn't working, or up the dosage, switch things around. And then a lot of them, like it said here, all of them needed higher doses after 3 months.
Wow.
So this wasn't something they could take for a month and then be done. They had to stay on these medications.
So the body almost just decided it was normal and it wasn't going to respond anymore to that medication.
Right. And that's very common with pain medications. If you've ever been on pain medications, anti-inflammatories, things like that, a lot of times the body kind of adapts and gets used to it.
That's the word I was looking for.
Oh, yeah, good. But then you have to do something different. You have to change it up, or you have to increase your dose or something like that. That's one of the disadvantages to pain medications, is the body's ability to adapt and try and show you those pain signals to tell you something's wrong, right? Yep. Now, for the laser therapy group, the folks got laser treatment, professionally delivered, twice a week for 5 weeks. They used an 810 nanometer laser, which is an invisible infrared laser. Very, very, very tiny spot size, just about the size of the end of this ink pen here. And they delivered that for 30 seconds at 9 different points along the tongue, underneath the tongue, and along the lower part of the jaw. So, 9 spots, 30 seconds per spot, 6 joules per spot. So, not a huge dose, not a huge dose. I do think it's worth pointing out, if there's any other laser nerds listening to this, they used a very high fluence of 59.1 joules per centimeter squared. Again, because the spot size was so tiny, even though the power was only 200 milliwatts in this laser, it ended up being very concentrated and quite high, with a radiance of 1.97 watts per centimeter squared. That's fairly substantial. It doesn't do any burning or any cutting or anything like that. I doubt if it even produced any real warmth for these patients. Very, very small, 9 different spots though, and like I said, 6 joules per centimeter squared, which is pretty standard, I would say, in the treatment of pain.
It's interesting that it would be held on those spots instead of, some sort of sweeping pattern.
Yeah, now this was a Class 3B laser, which is a lower powered laser. However, with a lot of the Class 4 lasers, you're going to be able to push more power, and so you would use a scanning type technique because you could do a larger spot size,
right? And
so you could deliver doses like this quite quickly. So instead of 30 seconds times 9, don't make me do math here, 4.5 minutes. There we go. You could probably have it done a little bit quicker if you wanted to, but 4.5 minutes really is not a big deal.
No.
So you can totally use a lower powered laser for this just fine. You could also use a Class 4 laser, just brought down to a lower rate, or using a larger spot size. Yeah.
Interesting.
So again, twice a week for 5 weeks, so a total of 10 treatments there. And like I said, 3 spots on the side of the tongue that was affected on top, and then 3 underneath that side, and then 3 along kind of inside the jaw here, along the gums, along the gum line.
So you said side. Does that mean this is not the whole tongue? It's just one side or the other?
Yes.
Okay.
Yes. There's only one side of the tongue that's really affected.
Okay.
For these, because of the trigeminal nerve, it really supplies this whole half of the face from one side, and then the other side is the other nerve. So if you have a problem with one nerve, it's only really affecting that side.
Okay.
Yeah. So let's talk results. So very first, right off the top, when they looked at this, and they followed these folks all the way out to 9 months post treatment.
Nice.
So they said there were no adverse events observed or reported in either group, the medication group or the laser therapy group. So both came out to be safe for the patients. They also say that that there were no dropouts, so everybody stayed in the study.
Good.
Both for medications and for laser therapy. Sometimes if you have a treatment that's really inconvenient, like having to take a medication 8 times a day or something like that, people end up dropping out of a study. It's just it's too much on their lives. Or if you got to go in for treatment
for a long time,
daily for 12 weeks, it's hard to stick with that, so you end up with people dropping out. In this particular case, none of these participants dropped out, which is great. We get more numbers on that, but it also indicates that this wasn't inconvenient, both the medication route or the laser therapy route. It wasn't so inconvenient that anybody dropped out. So what worked better? Well, laser therapy worked better. They say that laser therapy had substantially different improvements with a faster, more pronounced, and long-lasting benefit over the medication route, right? They also go on to say, my next quote, they also go on to say that the results remained in favor of the photobiomodulation treatment through the subsequent follow-up period, all the way out through that 9-month follow-up. So not only did patients do better faster, but they did better on the longer term as well. That was for pain.
And that part doesn't really surprise me, knowing what we know about laser therapy.
Yeah, but for a lot of people, that's very surprising.
Yeah, exactly. I hope that opens a lot of eyes and doors for people, because this is what laser therapy can do.
Yeah.
So
that was on the pain. The other side would be like those activities we talked about, quality of life and taste and things like that. So quality of life, the photobiomodulation treated patients were significantly more responsive based on all of their functional scores as well, for everything from work and sleep to smell and taste, especially taste. Laser therapy did much better for taste. Eating and drinking, much better. Speech, pronunciation, brushing their teeth, all of those were better in the laser therapy group than they were in the medication group.
Nice.
I have two more quotes, and I want to kind of do a recap here. But I thought these couple of quotations were pretty important. They say, for the medication group in the study, the doses of medications needed to be increased after 3 months for every patient. Wow. All of the adjusted medication regimens remained unchanged thereafter up to the last follow-up time point. So they had to have more at the 3 months, but then they were able to last through the 9 months without any additional changes. They do say that, in contrast, none of the photobiomodulation subjects were in need of additional analgesic medication throughout the entire procedure. So, throughout the whole study period, which indicates a long-lasting beneficial effect on pain by laser therapy. They also say that this study demonstrates the efficacy of the 810 nanometer laser in modulating nerve pain intensity and improving function and quality of life at the mid and end treatment sequence, and sustained throughout all the follow-up time points, 1, 3, 6, and 9 months, which at least compare to or exceed the gold standard of care pharmacotherapy, while being safe and well accepted by the patient. That's a complicated way to say that laser therapy worked better and was better for the patient.
Just overall. So, we know laser therapy helps to repair tissues, and neuropathy is a damaged tissue. So medication seems to cover up pain, whereas the laser therapy helps to repair and work through that pain and make it better.
Yes.
Very simply. Yeah, let's just talk about the time involved here. You had people that got a total of 10 laser therapy treatments over not even a month and a half that were doing better at the 9-month follow-up than the people who were still taking medications. That's amazing.
Who were destined to stay on those medications to manage their pain.
And increase, and just based on what we said previously, you get to that point where you just aren't responsive to that medication anymore, so you have to increase it and increase it and increase it. Right.
Yeah. Less than ideal. Really. So, as kind of a final statement, what this study shows is that laser therapy outperforms medications for this particular problem, for burning mouth syndrome, for nerve pain in the mouth. There's faster relief, so you get relief quicker. There's lasting relief. You don't have the ongoing medications you have to keep taking. And you end up with better function, better taste, better eating, better speech. All of it is better with just a few sessions of laser therapy. So,
and I'm thinking of the cost factor as well, because if you have to keep increasing your medications, that's a continued outgoing cost, whereas there's a fixed cost, if you will, for laser therapy treatment.
Right. Yeah. How much does 15 years of Cymbalta cost compared to 10 sessions of laser therapy? And you're going to end up better off with the laser therapy.
Right.
It's not that expensive. You can get laser therapy done for somewhere between like $40 and $200 per session, just depending on where you're at and what you can get. But for it to work that well and then not have to worry about it in the future, there's some unknowns here. People do respond differently.
Right.
I do wonder if they had done more than 10 sessions, if they would have even had better results from the laser therapy group.
You never know.
I mean, yeah.
But you'd almost think so.
Maybe. I think it's really great to see that just that many sessions gives you a lasting benefit. But in a lot of cases in clinic, what we see is we'll taper people out of care. We'll go down to once a week and then down to every other week. And then let them go. And we do see that can have, continued impact and further pain reduction in a lot of cases. You can't really do that with every study necessarily. Right. And studies like this are great for showing, what is just exactly this, what does it really do? I think it's just really pretty exciting.
It just opens up potential.
Oh, yeah.
So, and it's, I always say it's worth a try.
Absolutely.
It's worth a try. So.
Another concern I've heard people talk about is, I want to get on medications right away because maybe they'll help, but I would also be interested in doing laser therapy. And that's something that wasn't really brought up as much in this study, but we've seen brought up multiple times, that you can do both. You can go ahead and start the medications, and you can also have laser therapy. And most medications are not going to reduce the effect of laser therapy as far as we know. anti-inflammatories can. But if you're, say, on gabapentin, and you want to have laser therapy done for this burning mouth pain, there's no indications that they would conflict.
Right.
So,
you've done in-clinic treatment for people with neuropathy who are on gabapentin, and eventually, through doctors' guidance, they get off of it.
Right.
Because the laser therapy has helped that particular person.
Yeah.
So. Yeah,
there's no reason to think that you couldn't be in that situation with this particular condition either. Absolutely. Yeah. Absolutely. So, a lot of exciting stuff. Again, if you're looking for a good laser therapy provider near you, highly encourage you to check out the website, lasertherapyinstitute.org. You can click on the tab labeled Clinics and find a clinic near you. Also, if you're listening on your phone or some kind of podcast app, would you please give us a rating or review? This helps other people find us. It takes 2 seconds of your time. If you're on an iPhone, just scroll down to the bottom and tap the number of stars you think we deserve. Also, it'd be great if you could write us a quick review. Let us know what we're doing well. Also, let us know what you'd like to see changed or what you'd like to see be different. Suggest a topic for us.
Exactly.
Yeah.
Yep. So.
Good. Okay, well, Happy New Year. Happy New Year.
Happy New Year.
We hope to see you much more here in this coming 2023. Every 2 weeks, we'll be doing one of these episodes, patient-focused, about research and laser therapy. And, I mean, we have studies published more often than we can even do a podcast on, so it should be a really exciting year.
You're overloaded with research.
So much. So exciting.
He boils it down so that we understand it. So tune in again. Thanks
very much.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.